All happy MLK Day. Dr. Leek here. Welcome to another episode of Eclipse Unscripted. I'm your host. Tonight we are going to sort of wrap up everything that we've been talking about and learning about together over the last month or so. And by the way, thank you so much for going on that journey with us. I hope it was helpful, that you had an opportunity to learn something, ask some questions. And tonight I want to continue that and learn a little bit more about the chronic pain patient. Hello, everyone. Welcome to the chat. I see you all. Thank you for waiting. We are getting started just a little bit behind schedule tonight, but fear not, we have a lot of things in store for you. In case you're wondering, and you showed up tonight, you're expecting a big announcement. Well, that is true. We do have an announcement to share. That will be coming just later in our broadcast tonight. And so stick around to find out what's coming. So, you know, we talked a lot about the difficulties of being a pain patient. And I think that there's some interesting topics that came up along the way. The idea of opioid-induced hyperalgesia, right? And how that can be weaponized against a patient and the patient accessing care. The idea of ACE scores also being manipulated or used against the patient rather than as a tool to help plug that patient into a better understanding, a better treatment plan. We learned that it doesn't always pay to be honest about your history of addiction, particularly as it relates to alcoholism or even opioids, right? How that can be, even if it's something that's remote, it's been managed, it's been dealt with, you're in the proper channels, but it's still being brought up and used against you. You know, that's just unfortunate, to say the least. And so, you know, all of these broadly applied protocols, which I still believe were designed to the patient's benefit, at least at large, right? When you're talking about population-based medicine, for safety and efficiency and quality of care, at least from a high perspective, we can see really the damage that it causes on an individual level. So if this channel does nothing more than to highlight the need for individualized care, then I think that alone will be a win, because especially in the world of pain management, in such a specialized field, you know, pain is very unique in the sense that really everybody experiences pain to some degree in their life, right? It's part of being human. But chronic pain, severe pain even, depending on the statistic you're looking at, 20 million people in the country just have trouble going from their bed to the bathroom because of severe debilitating pain. And yet, despite all of that, there's only 2,500 pain doctors, board-certified pain doctors, give or take. And still, so we're so specialized, but it seems like still we're painting the picture with such broad brushes that unfortunately so many people fall in between the cracks. And so that's what we're advocating for is the individualized care approach. Before I get into it any further, let me introduce some new members to the team tonight. Of course, you all remember Kevin, Mr. Producer. He's in the back here making sure all the sound and video comes in. Hello, Mr. Producer. Thanks for being here tonight. Of course, I wouldn't be here without you. I don't know if his mic is working, so I'm going to keep talking. And then we have Evelyn Ray in the room tonight. Go ahead and say hello, Ray. I don't know can anybody hear you?
Hey, guys.
Yeah, there we are. Awesome. Okay. Yep, there's Kevin. He's switching the cameras around.
Oh, yeah, I'm here.
We're still developing the system, so I appreciate your patience and making sure we get all this stuff worked out. There's Evelyn. Hello, Evelyn.
Hi.
So she's helping moderate our chat tonight. Make sure that I don't miss anything in the questions, that your needs are being met. And I appreciate you all chiming in. That's so awesome to see everybody engaging and fighting for each other, essentially, for a better quality of life. So let's take it back a minute. The title of tonight's video, as you've probably seen on the thumbnail, is Compliance is Not Healing. And I think, you know, in the pain management world, that is something that often gets confused, and overlapped with each other, perhaps when it shouldn't, right? It comes down to these broadly applied protocols that we've been talking about, and sort of even the my way or the highway situation, right? The lack of collaboration between the physician and the patient. And so, this comes into play with a lot of different things, whether it's access to appropriate medication or not, but also it's sort of the carrot that gets held out for a patient that may be required to get an injection, or may be required to get a stimulator and that type of thing. And so we've talked about that. A lot of patients sort of feel pushed, prodded, coerced, manipulated into certain treatment plans that maybe the patient has questions, concerns about that aren't being addressed. But they feel like the only reason they can do it, or they have to do it, or they should do it, is so that they can have access to medication or what they perceive as being adequate pain management. And certainly that exists. There's no mystery at all about that. And we talked about some of the reasons why that exists. And it does ultimately boil down to the fact that pain is, or that a pill is not a plan, right? One of my attendings who taught me in my fellowship, a very good doctor, but she didn't dabble in opioids very much, if at all. And her idea was that simply opioids are a road to nowhere, is what she sort of phrased that as. And while that may be true on some levels, it is not true for every patient. For some patients, perhaps a lot of patients, that is the road to somewhere. Somewhere meaning better quality of life, the ability to move around, feel like a human being, go to the grocery store and feel like a functioning member of society, right? So there definitely has to be some even ground. But we definitely also know that the greater legislation at large, whether it's the feds, whether it's the state, whether it's your professional societies that help to weigh in on our individual practices, right? That is not the standard of care. And the idea is that there has to be a better option, perhaps a more sustainable option. And when you have evidence that supports other alternative treatments, the argument becomes very difficult to make in order just to do one treatment. So what ultimately ends up happening, you have patients that are compliant, and unfortunately, they're still having a lot of pain. Their needs are not being met. Their dysfunction is still prevalent. And that's quite unfortunate. And as a patient, I can imagine what that must feel like. It must feel very defeating, because you have this idea that you're going into a cutting edge specialist who's going to listen to you and diagnose you and give you the best treatment and fix you. I have a lot of people that just want to be fixed, right? And I totally get that sentiment. And, maybe there's some differences of approach, and, a lot of patients may end up on medications. And if, as a patient, you're feeling for once that, yes, I may be living life 4 hours at a time, but it does allow me to live life 4 hours at a time, whereas before I couldn't. So out of fear of perhaps losing that access to what is perceived to be better, then you sort of go through the motions. Every clinic visit, you say, hey, no, I'm feeling good. This medicine's helping. I don't want to change anything. Sounds great. And that's from the patient's perspective. And then from the physician's perspective, you're passing your drug screens. You're showing up for your random pill counts. You're allowing me to document everything I need to document in order to remain compliant. So I'm feeling good about things too. And so the cycle continues. And it's a very easy cycle to get into. But maybe over time, the 4-hour period you're taking this medicine, it just doesn't hit the same way, or you're really pretty getting tired of taking all these medications all the time. And the frustration level builds, and then before you know it, your physician isn't doing anything for you, or so the sentiment is, and frustration rises, and here we are. How come I'm still suffering when I'm being compliant? Well, that's the bottom line that we're talking about tonight. Compliance does not equal healing. And to be fair, the system does not really promote a healing sort of outcome, for most patients, for most specialties in the United States and perhaps elsewhere. But I don't think I'm being too controversial when I say healthcare is a maintenance program. It's not a fixing and discharging program, right? And this is sort of how it's been for a long time. Well, high blood pressure, here's a pill. Well, diabetes, here's a pill. Dealing with obesity, here's an injection. Pain, here's a pill or an injection, right? So the idea that we're actually fixing anything is almost laughable. And certainly the case is true in the mental health field as well. And pain and mental health are so interlinked with each other. It's all maintenance, right? And the system is designed like this, and it's been like this for so long that from a physician's perspective, it's hard to break the mold, right? And from a patient's perspective, that almost becomes the expectation. Not that there's earnest, well-meaning patients out there that want to dig down deep, find the root cause and cure themselves. No, there's plenty of patients out there that are like that. Most of you who show up tonight, who are involved in this community, are not the norm. I would say you're interested in something better. You're interested in taking back control of your life, right? And whatever avenues you've been going down so far, you've been unsuccessful. And so, there are those patients, but not everybody. Probably most people, I would say, are so conditioned to the idea that you go to a doctor to get a pill. And there's really not much to change that sentiment. And so I think also, physicians, we're trained to understand that there's more to this, that healthcare in general can be curative to an extent, right? Certainly more than just maintenance. But it's hard to do from a physician's perspective. A lot of it is education. A lot of it is hand-holding. A lot of it is coaching and encouragement. And it takes a lot of work. The heavy lifting comes from the patient. Now, there's patients that want to do that, but a lot of patients don't. So speaking from a physician's perspective here, I think that can be very exhausting, right? Especially in the short times that we have with patients, in order to provide that level of care and service, to give patients the tools that they need and monitor them and encourage them along the way. That's very challenging. And a lot of times we get pushback. I'm saying this as a pain doctor, even from patients in the pain community, a lot of times I get pushback. And a lot of it is legitimate, right? Well, it hurts to move. I don't want to move. I'm afraid of moving. I'm afraid I'm going to hurt something. Okay, I get that. That's a legit rational fear. But let's talk about it. Maybe it's not as high of a risk as you might think it is. Or maybe we just need to move in different ways. A lot of it is dietary education and the costs associated with that, and learning how to make better choices, but on a consistent long-term sort of timeline, right? And not everybody is educated on how to do that, right? And physicians don't feel like they can really provide a high level of intervention in that way. And so because we're very complex humans, right? I mean, so much of the time we boil ourselves down to like, one little mechanism of action. And if we take this one pill that affects this one mechanism of action, we'll get to where we need to be. But come on, we're so much more dimensional than that. And we know as we deal with patients with pain, I mean, it's not just physical. There's emotional components and spiritual components and relational components that significantly contribute to how someone experiences pain. And so, again, to boil all of that down to one particular pill, it's an underservice. And if that is all that your plan of care consists of, then, and you're still suffering, then you probably need a better plan of care. And that's just the bottom line. Really, there's, nothing too magical about that. I think another part of the problem that we face, the idea of pain management. When I started this clinic, I did not want to use the word management anywhere in my title, on my website, in any of my branding. But then all my website guys were like, well, they're not going to be able to find you on Google if you don't put pain management, because everybody knows this field is pain management. So I was like, okay, well, I guess we are pain management. But the idea of pain management sort of just, it moves away from the idea of diagnoses. It moves away from root cause analysis, right? It moves the whole treatment model towards management, right? Symptom management. And so whatever it was that was causing your pain in the first place, well, it's managed now, right? Think of it like with diabetes. If you eat nothing but, sugar all day long, well, that's okay because we have insulin. So we're going to manage it with insulin. So don't you worry. But maybe a proper history and physical would, unmask the idea that, oh, well, it's the diet that needs fixing, or it's the stress eating because you're dealing with a lot of anxiety or depression or maladaptive coping skills. Or maybe, you're living in isolation and so you don't have any accountability partners in your life to help you make better decisions, right? We all need that. So that's a little bit of the insight to the complexity of a human, but it just gets so boiled down to one little treatment opportunity each visit that, here we are. So pain management is, again, it's not curative in and of itself. It's management. And so I think almost to find a doctor, and lots of doctors do this, not every doctor, but a good pain doctor is going to help you figure out what's causing your pain. I mean, it's not controversial to say that, but from what I'm hearing so much of the time, that's really not what's happening, right? The problem with managing pain is once your symptoms are managed, the drive to obtain a proper diagnosis and root cause analysis and treat the underlying condition is diminished, right? Well, I'm feeling okay now. I guess there's nothing more I need to do. And I think that's the problem with opioids in a lot of cases. If you're feeling good, what's the incentive to go to another doctor's visit and go see another specialist and get another lab and do all these other tests, and participate in the full rehabilitation program? What's the incentive? Because that's all really hard work. And I came here to feel better, and I'm feeling better now. So thanks, doc. All right. That's a very common trap I think a lot of us can fall into. The problem with it, again, is that it's temporary. And the longer that you go down that plan, remaining compliant, of course, right? That's the idea. Without fixing that underlying problem, the management approach will eventually run out of steam. And so that, I think, could be a big reason why compliance itself is not healing. I talked about the system. The system will pay for steroid injections. The system will pay for opioids. But the system won't pay for platelet-rich plasma injections, PRP, stem cells, or other regenerative type treatments, right? Healing treatments. Of course, I can't say it's healing. It's not healing, but it can support healing. Laser therapy as well, right? Certain supplements, or yes, insurance will pay for maybe a dietitian to see you, but really, are you getting the maximum amount of benefit hearing from a dietitian or working with a dietitian or a sports coach, for that matter, someone to hold you accountable to show up at the gym and really strengthen your muscles? Again, our system will pay for things that feel good in the moment, but don't actually result in long-term change. And that is where I and my team and those I work with, that's what we are trying to change. At least bring some highlight to not change the narrative, but to give a voice to those who already are on that path, who already want something more than what you're getting. And I do steroid injections all the time because that's what insurance is paid for, but they come back in 3 months. They come back in 6 months. Everybody knows this. It's not a secret because it's not healing. It's reducing inflammation. It's reducing pain, and it's good in the moment. But the more you do it, actually, the worse things get. We know that to be true. So, again, once the patient's feeling better, the doctor says, okay, patient complaint resolved. Patient feels good. They're compliant. Job well done. Pat myself on the back. All right. Unfortunately, it doesn't result in anything long lasting. And, to be fair, not everybody has a condition that is readily curable. I mean, I hate to put it that way, but we are humans with broken bodies, and not everything can be saved. So there's no role, right, for management. Of course, there's a role for pain management because we can't fix everything. But I don't think that's where the majority of patients fall into. Maybe that's just me being optimistic. So yeah, I think, from a physician's perspective, that's sort of what wraps up the idea of why everything seems to be checking the boxes, but you just don't feel like you're quite getting to where you want to go. And, that is what brings me to, tonight's announcement, right? I know you all have been waiting patiently. So tonight's announcement, this has been actually a work in progress for some time, but I didn't quite have all the pieces put together. I've only had this clinic for, I guess, coming up on 5 years now, so I know that seems like a long time, but everything in healthcare moves very, very slowly. It takes 6 months to get credentialed, for Pete's sake. I had to kind of feel out the game, the patients, who's referring patients to me, what their expectations are, what the patient's expectations are, what my capabilities are. And I feel like I'm at a good time where it's like, okay, I can see where the weak points are, and I can see what's working also. And I've been very fortunate to be surrounded by people that are like-minded, that really care about patients and want to see the best outcome possible, right? We got to make all of this effort and education and risk-taking fruitful, right? It's way more than a paycheck. Not that the paycheck is worth anything, but certainly not like it used to be. But I would say this is higher level thinking, and there's a huge need in this country. And I'm not saying I'm going to fill that need. I'm not saying this is going to be your one-stop shop for everything pain, because I just don't know that much information, quite frankly. But I will say this. I think that we are going to offer something that is unique. We're going to offer something that I think will positively affect a lot of people. And it's something that's not being done before. And it seems like there's a great need. And if we can be a conduit for somebody that might be in a dark place, if we can be a conduit to say, hey, I see you, I hear you, wow, I did not know that, thank you for sharing. Or be someone to support you in your wins, right? It doesn't always have to be negative and doomsday speak. This can be a community that you come to say, hey, guys, guess what I found? It worked for me. Maybe somebody else should try it. That's what I'm looking for in order to accomplish for you all. And so finally, we've been able to do it. Eclipse Unscripted is no more. That is true. Eclipse Unscripted is no more. It is now referred to as Eclipse Pain and Recovery Network. Okay? Pain and Recovery Network. Kevin, do we have the new graphic? We're going to switch this officially like it's New Year's Eve. Here we go. It's coming. You want to put it behind me? Here we go. Check this out. I'm getting reports that there are no sound.
I have sound. I'm hearing it.
Well, suffering Rebecca.
Interesting.
Technical difficulties. Yo, we're all in healthcare, okay? What do you think this is, Hollywood? Okay, come on. So yes, so we're going to play that again in just a minute. But what we're doing is 4 shows a week, 4 live shows a week. So I'm on Monday night. Here we are. Tuesday night will be Jose Vasquez. He is a master of physical therapy with an emphasis on sports coaching. And actually, he was the sports coach for the Texas Rangers for the last 20 years before he decided to come work for little old me. And so he's fantastic, and he's going to have a lot of great things to say and draw upon his experience. Wednesday night, we have Katie Lovett, a registered dietitian who shares the same vision in the idea of individualized care. I don't want to steal her thunder, but I knew she was the right one when this whole controversy about the upside-down food pyramid came out. You remember that here just a couple weeks ago? And I was like, Katie, what are your thoughts on that? She's like, well, you know, it's interesting, and she'll probably talk about it a little more in the future, but she's like, well, it doesn't really change my practice much because we focus on individualized care. I was like, exactly, thank you. None of these broadly applied protocols that always kind of go and mess things up. So there's that. And then, of course, last but not least, our cleanup hitter is none other than Keith Johnson with Invisible No More. That'll be Thursday night. So this is what we're going to do. We're going to give it a 3-month run at it, each of us doing 1 show per week live. So you can show up. You can give us your questions. You can learn something. And if this is something that you're going to see benefit out of, then leave us a like, leave us a follow. Tell somebody who might actually benefit from it as well, because that's what we need to get this ongoing. You know, this is very labor intensive. So if it's not going to reach the people that we need it to reach, then it'll be hard to justify continuing on, at least in such a routine, frequent fashion. But it is something that we believe in. I feel like there's a lot of need for it. And that's what we're going to get going on. So how are we doing on that video, Kevin? We're going to give it one more try. If we can't get it tonight, I'll tell you one thing we're going to do. We're going to wrap up the live, and then we're just going to post it. So you can go and watch it afterwards, leave a comment, tell us what you think, and we'll go from there. But yes, tomorrow is Jose. And Jose, what time is Kevin starting? I think this week is a little unique. Tomorrow, Jose's coming on at 8:30 Central Standard Time. We're all based out of Texas, so that's the time that we use. So 8:30 Central Standard Time. Normally it'll be at 7 this week because everybody's schedule, and being the first week, we're sort of phasing into it when we can. But don't hesitate to check out Jose tomorrow. You gonna give it one more run, Kevin?
Here in a second. They're still saying they don't hear the music. I have music playing behind you.
Okay. Well, no worries. Let's go to the comments. I want to see what you guys are up to. Yes, Invisible No More live Thursdays. New home is right here. Right here. Well, actually, right over there. I don't know if he wants to sit here or not, but Keith will be in this room Thursday night at 7 p.m. live. Oh, so late here. Do my best. Okay. Where are you at, Kate Bakes? I'd like to know where y'all are coming from, watching from. I know we have people watching from coast to coast, even Canada. And so, oh, yes, Keith says the sofa for me. Yes, it is more comfortable, I will say. So, yeah, this idea of, interdisciplinary care, I would say that's what we're trying to replicate in sort of this fashion. Now, everything we talk about, any education we provide, of course, cannot be understood as direct medical advice, right? Because that would require a predefined physician-patient relationship of a sort, provider-patient relationship, and we just don't have that on this forum. So definitely take it for what it's worth. It's simply education, and the strong recommendation is that you take it to your physician and have those conversations, right? I always say this, on my shows, if the physician's going to hold you accountable for X, Y, and Z, there's nothing wrong with you being able to hold your physician accountable, or at least asking questions. Hey, doc, how come, we've been doing this for some time and, it's great and all, but isn't there something better? And maybe we need to do more tests. Maybe, we need to do a different exam, or, figure out what else we can do here, because none of these treatments are going to be around forever. That's the challenge. I know Keith has talked about that, the manufactured opioid shortages and things of that nature, right? And of course, God forbid anything worse happens, we lose access to certain medications. That's going to be a very difficult place to be. So any opportunity we have to free ourselves from the medical society, I think, we should take as patients, right? And so this idea of interdisciplinary approach sort of reflects the idea that we are complex humans, we are complex beings, and a pill is not a plan. It's an undertreatment of what could be, and so and this is supported in the literature. This idea of interdisciplinary care. There are some programs that have multidisciplinary approach, right? You have a physician, a psychiatrist, a dietitian, a PT, all on one team. But it's not traditionally supported, and so it requires some finagling and some, financial hoops that you have to jump through. And this is sort of a way we can mimic that, at least by providing the education, support, and a community, really. That's the ultimate goal, where we can come together, celebrate each other's wins, learn from each other, and help each other out to something better, whatever that might be. It may not be best, but it's going to be better. That's the idea. Improving our quality of life. That's what it's all about. So I'm going to go ahead and hop off now. I know that we're still working on some connections back there, but do stay tuned. We are going to post those videos tonight to give you some insight on what's to come. Okay. So again, thank you so much. I appreciate all your comments. Yes, Carol, this week only, 8:30 tomorrow night. Normally we're going to be doing 7 o'clock. So until everybody's schedule sort of falls into place, we'll do 7s. But what we will do is post premieres the rest of the week, so you can see on our channel. Oh, by the way, we are changing our name from Eclipse Unscripted to the Eclipse Pain and Recovery Network. So that's how you will find us. But if you're already subscribed, then you got nothing to worry about. Definitely hit that notification button so that when we do set premieres for the week, you will be notified when we go live. That way you won't miss out on it. Okay. So very good. All right. Thank you, everybody. Until next time, have a great week.
Streaming.